Hi, brothers and sisters. In November 2017, in the evening, while I was in the kitchen washing the dishes, I suddenly felt a sharp pain in my left ear, which spread to the half of my head. If I were to describe it, it was like a burning fire that spread its flames to my forehead, eye, nostril, temple, cheek, jaw, and the throat. I was shocked. Imagine putting a burning coal in your ear. I took 2 Tylenol pills, but they didn't help at all. At night, I cried because I couldn't sleep because of this pain. The next day, I went to the emergency room. At that time, I didn't have a family doctor. After the checkup, the doctor suspected. He suspected because he didn't see any signs of infection. So he suspected the beginning of an ear infection. And he prescribed me the antibiotics. I started taking them, but I didn't feel any relief. I was desperate because every second I lived in indescribable pain, which exhausted me mentally, physically, and emotionally. Then I went back to the emergency room, and another doctor prescribed me the cortisone, but that didn't help either. And one day, one afternoon, as I was lying down next to my son to put him to sleep for a little nap, I closed my eyes and I had a vision. In this vision, I was in the deep canal of my left ear. Suddenly, I saw a black spider with its tentacles outstretched and stuck into the parts of my head, into the bones, nerves, arteries, vein. Then I tried to pull it out, stretching my hands to grab it, but I couldn't reach its tentacles. The vision was over and I opened my eyes. Then I said to this black spider in my mind, I don't know who you are, I don't know what you are, but I will not get rid of you. So in this vision, it became clear to me that I will not get rid of this problem in my ear. Then I went back to the emergency room for the third time. And the next doctor sent me to the otolaryngologist, ENT. While I was waiting for the appointment day with this specialist, the winter holidays had arrived. I had invited guests for the new year on December 31. I had invited them before November, before all these sufferings started, and I felt uncomfortable canceling the party. On December 31, being at this table with a doctor friend, she was sat down next to me. I described the symptoms of my pain to her and asked her opinion if she knew what disease I had. She started to analyze my symptoms, but all of a sudden the guests started telling funny joke. She started laughing, and after that she forgot about my question. I was very sad, but I didn't bother her anymore, not wanting to spoil her joy and the guests' joy of the winter holidays, of meeting the friends, of having fun, of eating and drinking together. But the next day, listen please what's happening to me. The next morning, I woke up at 6 a.m. I was lying on my stomach. Suddenly, I felt a warm spring breeze. I could hear the bees and flies buzzing around me. I was very surprised and thought, oh, what kind of spring when it's January 1st and outside is about minus 25 degrees Celsius? Suddenly, I felt a bundle of energy, if I can call this a bundle of energy, entering my spine. And from the spine, it spread throughout my body. This energy was like sparkling champagne bubbles, very refreshing, very pleasant. I felt someone's presence on my right, and my shoulder and my right arm became warm. And all of a sudden, I felt a warm hand on my left ear, where the focus of pain is, where the fire is. This hand began to gently caress me from the ear up to the top of my head, like this. I think it lasted about 30 seconds. I didn't move, I didn't open my eyes, I just didn't expect this. Then it was all over. This was not in a dream or in a vision, this was in reality. Our Lord Jesus Christ had visited me, our spring, our Easter. After the new year, I went to this otolaryngologist who diagnosed me with the trigeminal and glossopharyngeal neuralgias, an incurable disease. Now I would like to read you a little information just to have an idea what represents this disease. The cranial nerves are 12 pairs of nerves that exit the brain and the brain stem. The fifth one is the trigeminal nerve that has 3 branches: the ophthalmic, the mandibular, and the maxillary. The ninth one is the glossopharyngeal nerve, which connects to the areas that include the back of the throat, tonsil region, the base of the nose and ear. Trigeminal and glossopharyngeal neuralgias can be caused by anything that compresses or irritates the trigeminal and glossopharyngeal nerves. The compression can be due to a tumor or blood vessel close to the nerve. There are some diseases that affect the nerve, like multiple sclerosis, shingles, viruses, infections, aneurysms, chronic meningeal, inflammation, or lesions that irritate the nerve roots. There are also the unknown causes called idiopathic. The pain of the affected branches is felt in the forehead, eye, cheek, gum or teeth, temple, throat, tongue, nose, and ear. If it's a glossopharyngeal neuralgia, it's deep in the ear. There are 2 types of trigeminal neuralgia. The type 1 is characterized by sporadic episodes of excruciating facial pain as intense, stabbing, or electric shock-like, triggered by facial movements or contacts with the face, most often unilateral, but it can be bilateral. There is no test or imaging that can diagnose the trigeminal neuralgia. The type 2, an atypical form, which manifests as a constant pain of burning, aching pain with attacks of sharp stabbing pain, but less intense pain than the type 1. But some patients may experience both, and the type 1 and the type 2. Unfortunately, with time, the pain-free periods become shorter. The treatment includes the anticonvulsant medication, baclofen, opioids for short time to avoid the addiction. There are surgical options like microvascular decompression, which consists in removing blood vessel, vein, or artery behind the ear. Cut the nerve, but this surgery has the risks. Radiation therapy or destroying the trigeminal nerve fibers. 0.3% of the population is affected by this disease, so less than 1%. Is not common, is a rare disease, thanks to God. But most commonly affects women over the age of 50. This disease is called a suicidal disease. According to the statistics, about 50 to 60% of the patients end their lives due to the excruciating pain. The first 2-3 years are very critical. Now I return back to my otolaryngologist. He prescribed me the drug pregabalin of 25 milligrams, which is a small dose. I drank it but without effect. I returned to the doctor again and asked him to give me a stronger dose of this drug or to give me another drug, but he did not agree. And I read later that this drug has also the bad side effects, or is effective for a short period of time, and after that you need a stronger dose. Then I asked the doctor, but what should I do then? And he answered, get used to living with this disease. And I listened to him. I have been suffering of this disease for 8 years. I don't take medication. I have got used to this pain. The pain increases when a cold wind blows on me or when I catch a cold. Then I put a warm sachet with salt or with the oats and barley, like this, on the affected area. Like this. And also apply the liniment extra strength with active ingredients of menthol 4% and chloroxylenol 0.5%. I'm going to show you. Here in Canada we have extra strength liniment, pain relieving solution for sore muscles and arthritis pain, called Absorbin. Maybe you have something similar in your country. named differently, but maybe with the same ingredients. Menthol 4% and chloroxylenol 0.5%. It relieves my sensation of pain for about 20-30 minutes. If it will help you, I'll be very happy if you are suffering from this disease. But I think God adapted the disease a little to me, because in the summer, as I mentioned before, when the heat starts, the pain decreases for about 2-3 months. And in the evening, after 9 or 10 p.m., the pain subsides, as if muffled, as if dulled, and this reminds me the air conditioner. The air conditioner has a day program and night program, silent mode. So I think God did to me this kind of programs, day program and night program, which allows me to sleep normally at night, to sleep well, and to be functional and productive the next day. I would like to read from 1 Corinthians chapter 10, verse 13. There had no temptation taken you, but such as is common to man. But God is faithful, who will not suffer you to be tempted above that ye are able, but will with the temptation also make a way to escape, that ye may be able to bear it. So I shared my testimony with you. I cannot give advices because each case is different and complex. Someone manages to heal. There are some victories. Another does not. Someone has divine healing from God. For someone, it gets worse. I don't know how intense my pain is compared to others, but what I know is that the first 2 years I cried a lot, trying not to complain to others, because each of us goes through hardships in life. In my case, it's better not to disturb this disease, and I believe that the Lord put such a doctor in my path who insisted on this point, especially since the Lord has shown me that I will not escape from this disease. In Acts chapter 14, verse 22, Apostle Paul exhorts the disciples to continue in the faith, and that we must through much tribulation enter into the kingdom of God. So Apostle Paul, being sick himself, healed many sick people, but he didn't heal Timothy and other of his disciples because God allowed this. But if God honored me with this disease, this means that I must suffer along with those who suffer. Why, I don't know. It would probably be unfair of me to preach to the people to suffer the torment of pain like Christ, while I would be an exception and I will enjoy the health, maybe. And I would like to read from 2 Corinthians chapter 12, the verses 7, 8, 9, and 10. Apostle Paul is writing, "And lest I should be exalted above measure, through the abundance of the revelations, there was given to me a thorn in the flesh, the messenger of Satan, to buffet me, the black spider, lest I should be exalted above measure. For this thing I besought the Lord thrice, that it might depart from me. And he said unto me, My grace is sufficient for thee, for my strength is made perfect in weakness. Most gladly, therefore, will I rather glory in my infirmities, that the power of Christ may rest upon me. Therefore, I take pleasure in infirmities, in reproaches, in necessities, in persecutions, in distresses, for Christ's sake. For when I am weak, then I am strong. When we are weak, then we are strong." Thank you very much for listening to my testimony. God bless you.